VSO. VSO Position Paper on Disability Inclusion. Introduction. We recognize that persons with disabilities are excluded from development processes, face challenges in accessing basic services, including health, education, and livelihoods. And are denied opportunities to participate in social, civic, economic, and cultural life. The United Nations Convention on the Rights of Persons with Disabilities, CRPD, explains disability as persons with disabilities include those who have long-term physical, mental, intellectual, or sensory impairments, which in interaction with various barriers may hinder their full and effective participation in society on an equal basis with others. According to World Health Organization (WHO) estimates, approximately 15% of the world's population, nearly 1 billion people, live with some form of disability. Of which 2 to 4% experience significant difficulties in carrying out regular day-to-day activities. Around 80% of persons with disabilities live in poor countries. Almost 180 million young people between the ages of 10 and 24 years live with a disability significant enough to make a difference in their daily lives. VSO. UK, aid. VSO. Purpose of the position paper. VSO sees disability inclusion as a development goal and a human rights issue. This position paper explains why disability inclusion is a priority for VSO. And how we intentionally promote disability inclusion through our programs and across our organization. Persons with disabilities around the world are too often denied rights and opportunities in all areas of life. The vast majority of persons with disabilities are poor. Too many are unable to access health facilities, start and stay in school, access job and business opportunities, use technology, and participate in social, cultural, and political life. Persons with disabilities are often treated unfairly, are not listened to, have low self-esteem, and face daily discrimination and marginalization. Many individuals with disabilities, including women and girls, face double marginalization, leading to even further vulnerability and exclusion. VSO UK Aid. VSO Marginalization. Marginalization is both a condition and a process that prevents individuals and groups from the full participation in social, economic, and political life. Based on factors such as age, caste, color, citizenship, descent, disability, ethnicity, gender, geographic location, HIV status, language, migrant status, non-binary identity, political or other opinion, race, religion, or sexual orientation, which are enjoyed by the wider society. Persons with disabilities face double marginalization when more than one of these factors apply to them, which effectively multiplies their vulnerability and marginalization. VSO UK 8. VSO Poverty. Disability is a cause and consequence of poverty. There is a clear link between poverty and disability. People who are poor are more likely to have a disability, and people with disability are more likely to be poor. People living in poverty are more likely to face risks and challenges that can lead to disability. Higher levels of malnutrition, inadequate access to health care, rehabilitation services, water and sanitation, unsafe working conditions, and a lack of understanding of disability itself being some of the factors. Up to 20 million women a year experience long-lasting complication of disability resulting from poor care during pregnancy or childbirth. While poverty impacts disability, the cycle of poverty faced by people with disabilities is significant. Persons with disabilities and caregivers face the additional burden of costs associated with medical treatments, care, and transportation. Costs of living with a disability are sizable. It is estimated that having a moderate disability increases the cost of living by about a third of average income. And having a severe disability increases the cost of living by more than 40% of average income. The poverty cycle represents a pressing human rights priority. VSO UK Aid. VSO Health. Persons with disabilities face a range of barriers to accessing healthcare. Compared to persons without disabilities, including costs, limited availability of services, physical barriers to access medical facilities, and inadequate knowledge of health workers to meet their needs. Women and children with disabilities, in particular, have poor access to sexual, reproductive, maternal, newborn, child, and adolescent health (SRMNCAH) services. Evidence shows that births by mothers with disabilities are less likely to be attended by a skilled health worker than births by mothers without disabilities. And that married women with disabilities are more likely to have an unmet need for family planning than married women without disabilities. In many countries, persons with disabilities, particularly women and girls with disabilities, fear seeking sexual and reproductive health services because of abuse and rights violations, including involuntary sterilization. VSO UK Aid. VSO Purpose of the position paper: education. More than half of school-aged children in developing countries are out of school. This means more than 33 million children are missing the opportunity to realize their full potential. Children with disabilities are more than twice as likely to have never been to school than children without disabilities. In many countries, the programs and services that target young children often fail to meet the developmental needs of children with disabilities. And are often too expensive, not inclusive, and only located in urban areas. Those able to go to school often face negative attitudes, a lack of resources to accommodate them, and education systems unable to ensure a quality education. Young persons with disabilities are greatly underrepresented in higher education. compared to the global literacy rate of 86%. The global literacy rate for adults with disabilities is as low as 5% overall. And less than 1% for women with disabilities. VSO. UK, 8. VSO. Livelihoods. An estimated 386 million of the world's working age people have some kind of disability. Persons with disabilities are more likely to be unemployed than persons without disabilities. Unemployment amongst persons with disabilities is as high as 80% in some countries, and can be half of that of persons without disabilities. Data on employment in many developing countries is still limited, and because a significant proportion of people, especially persons with disabilities, work in the informal economy, they do not appear in national data and are not covered by employment law. Persons with intellectual impairments can be 3 to 4 times less likely to be employed and more likely to have longer periods of unemployment. Often, employers assume that persons with disabilities are unable to work. But, when persons with disabilities do secure employment, significant barriers often limit the types of jobs they can have. Some countries have even identified specific jobs that are acceptable for persons with disabilities. All too often, there are environmental and attitudinal barriers in the workplace that exclude persons with disabilities and prevent them from reaching their full potential. VSO. UK, 8. VSO. Women and girls with disabilities. Women and girls with disabilities face the double disadvantage of discrimination based on gender and disability. They are often marginalized and subjected to violence. Women with disabilities are up to 10 times more likely to experience sexual violence. But most shelters and gender-based violence (GBV) programs are inaccessible to them. Between 40% to 68% of young women with disabilities experience sexual violence before the age of 18, and many women and girls with disabilities without their consent are subjected to forced sterilization, forced abortion, and forced contraception. In patriarchal societies, Women with disabilities, particularly those with mental health challenges, are often hidden from the local community to avoid the stigma associated with their families. Girls with disability are also seen as unmarriageable. And therefore, are denied their right to be socially engaged in society. VSO. UK, 8. VSO. Disasters and emergencies. During evacuation in disasters and conflicts, and during the outbreak of pandemics, persons with disabilities are more likely to be left behind or abandoned due to a lack of preparation and planning, as well as inaccessible facilities, services, communication, and transportation systems. Most shelters and refugee camps are not accessible to persons with disabilities, and they can even be turned away due to a perception that their needs are too great. During times of disasters and emergencies, disruptions to physical, social, economic, and environmental networks and support systems affect persons with disabilities more than the general population. Persons with disabilities are more likely to experience tangible losses due to shocks associated with disasters and emergencies, and require more intensive support and recovery following a disaster. There is also a potential for discrimination based on disability. When resources for emergency response and recovery are scarce. The needs of persons with disabilities continue to be overlooked. In long-term recovery and reconstruction efforts, meaning missed opportunities to improve accessibility and quality of services and infrastructure, and to build resilient, inclusive societies. VSO. UK, 8. VSO. COVID-19. The COVID-19 pandemic has brought the experience of persons with disabilities into stark reality. Including increasing their exclusion from key services and opportunities. COVID-19 is a health emergency and a global economic and social crisis that is taking a massive toll, especially on persons with disabilities. Many persons with disabilities have additional underlying health needs that make them particularly vulnerable to severe symptoms of COVID-19. Persons with disabilities are also at increased risk of contracting COVID-19 because of inaccessible information about the symptoms and prevention. Information is often not provided in accessible formats, such as Braille and sign language interpretation. People with disabilities using assistive devices and in regular physical contact with carers are also at increased risk. At the peak of the COVID-19 pandemic, 180 countries closed schools temporarily. Forcing 85% of learners, around 1.6 billion children, out of school. % of disadvantaged learners in low or lower middle income countries received no support. Online and digital learning has further excluded these children. Particularly deaf and blind children, many of whom have not been able to access internet, radio, and television lessons. Social distancing measures halted the delivery of critical face-to-face services, such as physical, speech, or behavioral therapy. Women with disabilities are particularly affected by the lack of access to hygiene needs, medication, testing, caregivers, and treatment. A deaf boy in Bidi refugee settlement in Uganda. Being instructed on how to wash his hands in sign language as part of creating awareness on COVID-19. VSO UK aid. VSO. Our position. Disability inclusion is a human rights issue and a development priority. As a development agency, working for a fair world for everyone, we work to ensure the rights of persons with disabilities are met, and they are not left behind in the global development journey. Our work is in line with the Sustainable Development Goals, SDGs, and the Leave No One Behind agenda. We believe in the rights of persons with disabilities to lead their own lives and to have a voice in the decisions that affect them. Nothing about us without us. We commit to making sure that VSO is an inclusive place to work and volunteer. We want to see that persons with disabilities are listened to and can live with respect and dignity. We work to achieve this by ensuring persons with disabilities participate in all development processes, and that our programs and organization are inclusive of persons with disabilities. We address the barriers to inclusion by challenging harmful social norms that feed negative attitudes and behavior towards disability, working to remove physical and communication barriers, and enhancing leadership and meaningful participation of persons with disabilities in decision-making. We work directly with persons with disabilities, as well as their families and communities, to achieve positive change. We strive to collect and use data on disability in a meaningful way, to identify and reach those most disadvantaged, and measure impact. In our programs, we endeavor to ensure that children with disabilities can go to school and receive a quality education. There is better access to sexual and reproductive health, as well as rehabilitation information and services. Skills development, entrepreneurship, and other livelihoods interventions are inclusive. Women, girls, and non-binary persons with disabilities including LGBTQI+ persons with disabilities are supported in addressing the challenges they face, especially in terms of gender-based violence. Our humanitarian responses are inclusive of persons with disabilities in planning, risk mitigation, and response. We address stereotypes and negative attitudes in policy and practice to transform unjust systems. We influence decision makers and duty bearers to understand disability, ensure international commitments and national policies translate into practice that empowers persons with disabilities. All information is accessible to persons with disabilities to facilitate their participation and enable them to engage with services and opportunities. Harness the potential of technology to ensure persons with disabilities are empowered. VSO UK 8 VSO Our approach. Promote the volunteering for development approach, which puts people and communities at the center of their own development. And enables voluntary action as a catalytic force to inspire change. Across all our programs. Promote social inclusion, gender equality, and advocacy efforts. Contribute to the Leave No One Behind agenda by encouraging innovative ways to continue delivering development to those most excluded. VSO UK 8 VSO Volunteering for Development. Volunteering for Development, VFD, is VSO's operating framework. For how we work with poor and marginalized communities and organizations to bring people together globally, to find creative solutions for transformative change. The three key components that make the VFD approach work are people-first principles, relational volunteering, core approaches of social inclusion and gender, social accountability, and resilience. VFD delivers on a deeper understanding of systems and communities, addressing the root causes of inequalities and injustice, and working to transform norms. Increase skills, experience, knowledge, and agency for all people. Diverse perspectives that generate new insights and innovation. Improve confidence and capabilities of individuals, communities, and governments to bring about change and transform power relations. Wider ownership and sustainability of the development process. VFD's impact. Public services are inclusive of the most marginalized groups and harmful social norms are addressed. Decision-makers are held to account and better able to respond to primary actors' needs and rights. Individuals, communities, and governments can manage vulnerability, conflict, and disaster. Changes in policy and practice to better tackle poverty and exclusion. VSO UKA VSO People First Principles. The People First Principles are at the center of our VFD approach. They enable us to build trust and participation of primary actors at all stages of the development process to design appropriate and effective programs and nurture a culture of reflection and collaboration. There are 6 principles. People-centered. We use participatory practice to engage and listen to the primary actors and a range of stakeholders at different levels to ensure our work is pro-poor and we are contributing to positive social change. Evidence-based. We design interventions based upon quality research and evidence and seek to understand the complex dimensions of poverty and power. This informs decisions and enables us to monitor how we are contributing to change. Effective and appropriate. We provide adequate and appropriate resources to ensure that the right people are in the right place at the right time. Investing in our volunteering for development approach as a powerful and practical way to tackle poverty and inequality. Reflective practice. We invest in and nurture a culture of learning, create space and time for reflective practice, and respond and act upon our learning to constantly improve our programs. Collaboration and knowledge sharing. We create opportunities for collaboration and knowledge sharing to promote good practice and improve our programming. Accountability. Our decisions are driven by the voices and evidence from primary actors to whom we are accountable. VSO. UK 8. VSO. Relational volunteering. The relational volunteering model is how we mobilize and manage diverse communities of volunteers effectively across the whole system to develop effective and trusting relationships within and across communities and institutions, and inspire and mentor individuals and organizations to be a part of the change. It is built on empirical evidence about how diverse volunteers working alongside communities contribute to change across 5 important, interrelated areas of inclusion. Innovation, ownership, participation, and inspiration. In sourcing and placing volunteers, we will particularly encourage volunteers from vulnerable and excluded groups to engage in programs and policy, as we believe that they have a lived experience of exclusion and discrimination, and are therefore better able to bring about change by reaching out to and working alongside marginalized people and communities. We will also commit to ensuring that any adjustments and additional support needed to facilitate an impactful volunteering placement are facilitated. VSO. UK 8. VSO. Core approaches. The core approaches enable us to identify and address the systemic issues of poverty and exclusion through a focus on resilience, social accountability, and social inclusion, and gender equality. In the delivery of our social inclusion and gender aspirations, we commit to understanding and working on the intersections between social inclusion and gender, and the other 2 core approaches of resilience and social accountability that will address existing power imbalance, enhance foundational assets across the 5 asset capitals: human, social, economic, environment, and technological. Support rights awareness, especially of those most marginalized, and capacities to claim rights, among many other interventions. VSO. UK 8. VSO. Twin track approach. We take a twin track approach to disability inclusion by ensuring that all of our programs are inclusive of persons with disabilities as primary actors, partners, volunteers, and staff. While delivering specific interventions targeting persons with disabilities. VSO UK Aid. VSO Co-creation in program design. We are committed to engaging with persons with disabilities as key stakeholders in program design. This includes stakeholder consultations, community meetings, and surveys as required. We will endeavor to speak to women with disabilities as a priority and assess needs and requirements, including understanding barriers they face based on their disability, stakeholder mapping, identifying solutions to problems and planning. Our education program in Rwanda ensures all aspects of teacher training and planning in mainstream schools address disability inclusion, whilst also implementing specific interventions for the identification, assessment, and support for learners with disabilities. In Kenya, the International Citizen Service (ICS) program promoted inclusion of young persons with disabilities, whilst also having specific activities carried out by deaf ICS volunteers to bring about a wider awareness and integration of sign language in the community and government administration. VSO UK Aid. VSO Collecting and promoting disaggregated data. VSO is committed to gathering quality data on persons with disabilities to inform our programs and advocacy. VSO has made, using the Washington Group Questions on Disability Data, WGQ, compulsory in our programs and across our organization to better shape our work and measure our impact. Learning from our initial work has shown us that the WGQ help identify persons with disabilities to be included as part of our programs and projects, and to develop a better understanding of our teams. Using the WGQ will help us to ensure we achieve our target of 5% of persons with disabilities from our total reach, and to become a more inclusive employer. Key advocacy areas for VSO also include addressing the data gap on persons with disabilities and promoting the WGQ. In Nepal, through using WGQ, we have identified 6% of the target group are girls with disabilities in our girls' education program, and interventions were designed to meet the needs of those girls. In Rwanda, we used the WGQ to produce a snapshot of children with disabilities in schools in order to design our inclusive education interventions. In Myanmar, VSO provided technical support to the Department of Population and Rehabilitation to embed the WGQ in the midterm population census. The data was collected, covering 4,316 households in all 14 provinces in Myanmar. The prevalence of disability was reported at 13%. VSO UK 8 VSO Enhancing Voice and Accountability. VSO is committed to social accountability, ensuring people have a voice in the decisions that affect them, and that those in power are directly accountable. Social accountability is one important way of ensuring decision-makers and service providers create an enabling environment and deliver quality services for persons with disabilities. VSO is committed to ensuring people with disabilities can actively participate in and lead social accountability processes. This means providing accessible information on international commitments and national policies, as well as promoting accessible tools and approaches to enable persons with disabilities to engage with service providers. We build the capabilities of persons with disabilities so that they have a voice and are able to demand their rights. We also help improve understanding of disability amongst decision-makers and other community members, so that the voice of persons with disabilities is heard and valued. In Ethiopia, youth with disabilities were trained on citizen lead monitoring, CLM, to assess the quality of services during the COVID response from the government. They alerted government agencies that quarantine centers were not accessible to persons with disabilities. In Rwanda, deaf youth used community theaters and community scorecards to identify key challenges faced by deaf people and formed a joint committee with service providers and local leaders to put in place improvements. VSO UK 8 VSO Recognizing diversity and intersectionality. VSO recognizes different forms of exclusion based on age, caste, color, citizenship, disability, ethnicity, gender, geographic location, HIV status, language, migrant status, non-binary identity, political opinion, race, religion, sexual orientation, and other status. It is apparent from the development paradigm that disability is ignored in many development interventions. Therefore, disability needs to be prioritized and understood within all marginalized groups. The intersection of gender and disability is a key focus for VSO. The women's movement has failed to address issues of women with disabilities, as they have historically excluded voices of women with disabilities in their campaigns and struggles. Similarly, the disability movement has not adequately highlighted issues and challenges faced by women with disabilities. GBV is a priority issue that cuts across all of VSO's core program areas and affects women, girls, and non-binary persons with disabilities disproportionately. GBV is based on several factors. Most prominently on social norms and power dynamics. Women, girls, and non-binary persons with disabilities in any context are at increased danger of experiencing violence. The issue of GBV and disability also appears in the context of SRMNCAH regarding teenage pregnancy and HIV/AIDS. This is especially relevant to women and girls with disabilities because of, for example, myths around their sexuality and their overall high risk of experiencing sexual violence, combined with discriminatory attitudes of health personnel. We are conscious that the intersectionality of disability and GBV, as well as other key disability and gender intersectionalities, including disability and sexuality, need to be explored in the design, delivery, monitoring, and evaluation of our programs. VSO UK Aid. VSO Policy influencing. VSO believes that, to achieve transformative change, we must work to ensure national and international policies are in the interests of all citizens and communities, especially the most disadvantaged, including persons with disabilities. We believe governments have a responsibility to protect and promote the rights of the most vulnerable and marginalized. While many governments have initiatives geared towards persons with disabilities, in practice, they are rarely reached. We will align and partner with movements, campaigns, organizations, and networks to bolster advocacy efforts. We will support local and national initiatives and interventions to take up issues of policy influencing and advocacy efforts in favor of persons with disabilities. We will carry out research and analysis to ensure our policy influencing is based on strong evidence of challenges and potential solutions. We are guided by the principles and articles set out in the United Nations Convention on the Rights of Persons with Disabilities, CRPD, as part of our policy influencing and advocacy. Most importantly, we will engage directly with persons with disabilities in our policy influencing and uphold the philosophy of nothing about us without us. In Pakistan, VSO and partners worked with parliamentarians to inform Rights of Persons with Disability Act, 2020. In Nepal, as a result of policy influencing, the government of Nepal has endorsed the Equity Strategy Implementation Plan, ESIP. VSO is implementing the plan at the district level and has established a database to track out-of-school children, girls, children with disabilities, and marginalized children. VSO UK Aid. VSO working in partnership with persons with disabilities. We believe that to achieve systemic change, persons with disabilities and disabled people's organizations, DPOs, must be at the forefront. We are committed to working with DPOs to strengthen their agency, rights, and participation in development processes. VSO UK 8. VSO. Our approach. Harnessing technology for inclusion. We are aware that technology can be an enabler for persons with disabilities. Technology can unlock education and skills development for children and adults with disabilities, bridge the information gap for young persons with disabilities, trying to access sexual health services, and provide life-saving communication. For women and girls with disabilities facing GBV. We are committed to using the growing range of accessible and innovative devices and social media platforms to enhance our programs, as well as promoting homegrown innovations in the countries where we work. Engaging in policy advocacy around increased investment in technology. As a route to disability inclusion and development. We will ensure the continued use of the advances made in accessible and augmentative technology during the COVID-19 pandemic to strengthen inclusion for persons with disabilities. Specifically, we are committed to meeting internationally recognized standards for web accessibility and continuing to design new IT solutions within the organization that are fully accessible. We will strive to use accessible technology, which is specific to the needs of persons with disabilities. For instance, accessible online platforms for virtual meetings and calls. We will work towards creating a barrier-free digital space for the people we work with. In Nepal and Nigeria, VSO produced information in audio format for blind people on COVID-19. In Rwanda and Kenya, VSO, with local partners, produced COVID-19 information in sign language, shared on social media. In Rwanda, a VSO deaf national volunteer created a social media network to help deaf youth receive and share information on SRMNCAH services. VSO UK 8. VSO. Our approach. Advocating for access to assistive devices and rehabilitation services. A fundamental challenge for persons with disabilities is lack of access to rehabilitation and assistive devices. This creates barriers to independence and participation in all aspects of life, making it a key factor in VSO's approach to disability inclusion across all our programs. For instance, VSO may train teachers on inclusion. But, if learners with disabilities are not able to reach school or to learn due to lack of assistive devices, such as crutches, white canes, braille slates, or hearing aids, then the intervention becomes questionable. Similarly, VSO's support for early identification of disability, in many instances, demands rehabilitation services, and yet, in many locations, this support is not provided. We recognize that provision of assistive devices and rehabilitation services is the responsibility of the state. We realize that it is not sustainable for us to directly work on the provision of assistive devices or rehabilitation services, but for our programs to have the greatest impact, we are committed to addressing this critical challenge. We will work with stakeholders, campaigns, and governments to highlight the importance of assistive devices and rehabilitation services for persons with disabilities, and our policy influencing efforts will be towards creating opportunities, policies, and services in favor of persons with disabilities. We will also promote the principles of community-based inclusive development, which focuses on local solutions and community ownership of services and interventions for persons with disabilities. VSO UK Aid. VSO. Our priority areas: education. We will continue our efforts to promote the education of learners with disabilities, mainly through outreach drives, enrollment, retention, needs assessment, and specific trainings. As in Myanmar, Kenya, Malawi, Nepal, and Rwanda, we will continue our work in the development and implementation of comprehensive pre-service and in-service inclusive teacher training programs. These are specific projects designed to reach out to learners with disabilities, and the training of teachers is a key component. In Rwanda, Nepal, Kenya, Myanmar, and Malawi, we have established partnerships with the governments to strengthen the capacity of the systems and teachers' training. This training aims to improve teachers' knowledge, skills, expertise, and attitudes, to conduct assessments of learners with disabilities, as in self-learning sign language videos in Nepal and Nigeria, We will design and develop curriculum in accessible formats and support institutes of curriculum development to do the same. VSO UK Aid VSO Our priority areas: health. Our SRM-NCAH programs will have greater emphasis to reach out to women and children with disabilities. We will continue to ensure community-level sensitization on the importance of SRM-NCAH, including the importance of immunizations, safe and appropriate family planning practices, including the use of contraceptives, safe pre-delivery and postnatal practices, safe motherhood, healthy menstrual hygiene management, and inclusive comprehensive sexuality education. Our volunteers will continue to work with local partners, especially adolescents and youth, to equip communities with the skills, knowledge, opportunities, and services they need to lead productive lives, focusing on helping young people gain confidence and receive information about SRM-NCAH and rights, to reduce the risk of early marriages, early sexual debut, teenage pregnancy, HIV and sexually transmitted infections, STIs. Our volunteers in many parts of the world have worked to build capacities of local doctors and frontline workers on prenatal and neonatal care, resulting in the prevention of disability. VSO UK Aid VSO Our priority areas: livelihoods. We prioritize disability inclusion as part of the livelihoods pathway and endeavor to take up initiatives to reach out to persons with disabilities. We recognize the challenges faced by persons with disabilities in the supply and demand chain, promote inclusive approaches in technical and vocational education and training, TVET, self-employment, and entrepreneurship. We will strive to develop appropriate partnerships in specific areas of decent work, employment, food security, and agriculture. We will align with interventions that promote or ensure social safety nets, social capital, and market resilience. We will look at and participate in broader campaigns for policy advocacy and engagement. For instance, in the food security lobby, partnering with disabled people's organizations working on livelihoods. We will take a collective approach towards building the capabilities of persons with disabilities. In our Bangladesh program, there is evidence of promoting inclusion of youth with disabilities into an agriculturally based value chain for the Secured and Sustainable Livelihoods Initiative. The project engaged 275 poor youth with disability in agro-based farming interventions in income-generating activities. Youth with disabilities were trained on various aspects of cropping and agriculture package of practices, including production, quality inputs, production management, post-harvest management, and market linkage in the farmer center. Along with provision of capital funds for starting income-generating activities related to agriculture. In Ethiopia, Kenya, and Zambia, small grants have been provided for persons with disabilities or their guardians for business startups. VSO UK Aid. VSO. Our priority areas: disasters and emergencies, safe, peaceful, and resilient. While there have been efforts to address the needs of persons with different disabilities in emergency response and recovery, fewer initiatives aim to learn from past experiences to improve long-term disaster and climate risk management at a systemic level. We will seek to change this, including ensuring people with disabilities are central to resilience building and action planning. We will continue to build capacity for communities to prepare, respond, and mitigate the shocks they confront. With a focus on disaster risk reduction, climate change, and conflict. We will ensure our programs reach and engage with persons with disabilities as part of any interventions and promote preparedness planning and risk mitigation to these shocks. We will take into consideration the intersectionalities and the different layers of marginalization of individuals and engage with them to ensure their needs and access requirements are met. In the past 2 years, 15 teams have been trained in disability-inclusive humanitarian responses and disaster risk reduction programming. We have undertaken risk assessments and resilience action plans in 15 countries. Bangladesh, Cambodia, Ethiopia, Kenya, Malawi, Mozambique, Myanmar, Nepal, Nigeria, Pakistan, Philippines, Sierra Leone, Tanzania, Uganda, and Zimbabwe. Within the risk assessments and action plans, we have ensured that persons with disability are represented and their priorities and needs are identified. In April 2019, VSO supported an emergency response to Typhoon Idai in Mozambique. Within Manica Province, in 17 localities of Susandenga and Makate, the teams distributed 180 tons of food, serving 13,448 individuals. The team worked with the Provincial Department of Gender and Social Action to ensure 24% of the disaster-impacted recipients of support had additional vulnerabilities, including persons with disability, elderly persons, orphans, and widows. In August 2019, 2 project offices in Myanmar and Sierra Leone participated in the delivery of humanitarian interventions during flood emergencies. In Sierra Leone, during the post-disaster needs assessment and registration, VSO advocated for the inclusion of the most vulnerable, including persons with disabilities, as well as ensuring that the cash and food distribution process was accessible to the most vulnerable, including women, elderly persons, female or child-headed households, and persons with disabilities. VSO UK Aid. VSO. Our priority areas. COVID-19. Due to the onset of COVID-19 and our responses, we have learned that persons with disabilities are disproportionately affected. We realize that they require information in accessible formats. Support and counseling services. And protection against gender-based violence. As part of the COVID-19 response, our programs have mainly targeted information flow to persons with disabilities in accessible formats. In Braille, audio, and sign language. Counseling services by volunteers, and in specific. Engaging volunteers with disabilities, as peer educators, and support service. Building capacity of communities and persons with disabilities. On the effects of gender-based violence. How to address it. Creating support systems. Signposting. And seeking justice. As in Rwanda and Ethiopia. Fostering a community-level behavioral change. For a greater response to gender-based violence, through community action. As in Zambia. Providing psychological counseling and support, peer educators. For enhancing mental health and well-being. As in our Kenya program. Providing digital classes for learners with disabilities. Many of our project offices implemented humanitarian interventions, which supported persons with disabilities. Adaptive programming enabled VSO to respond to the specific challenges posed due to the pandemic, to ensure reach to marginalized primary actors. In specific, messaging on disability and gender inclusion. And design of awareness materials in accessible formats. For example, in Braille and audio formats, Ethiopia and Nepal. Sign language interpretation across Ethiopia, Kenya, Malawi, Nigeria, and Rwanda. In addition, radio and television broadcasts were used for sensitizing the general population on disability and linkage with COVID-19, along with basic information on protection and prevention. Posters and social media were also used across our programs. We had specific interventions in Rwanda, reaching out to women with disabilities with information on gender-based violence and disability. And there were incidences of women with disabilities taking up cases against the perpetrators. We will give more emphasis to creating safety nets. Social capital and market linkages. VSO UK aid. VSO. Our priority areas: a disability inclusive place to work and volunteer. We are committed to being an inclusive employer. This is reflected in our policies and practice. And it is also reflected in our recruitment processes. We make reasonable adjustments for applicants throughout the interview process. We are aware of the challenges in some countries where we work in providing accessible working environments, and are working to improve this. We have taken strides to set examples of our offices being physically accessible for persons with disabilities. For instance, in London and Kenya. We are committed to raising awareness and understanding disability and issues of social inclusion with our own staff and volunteers. We are committed to training all staff and volunteers on key concepts of discrimination, inequality, injustice, and exclusion. We will continue to promote a zero-tolerance approach to any kind of discrimination based on disability, and also endeavor to have inclusive human resources policies at the country level. We have also started to collect disability-specific data of employees and volunteers. VSO UK 8 VSO Monitoring and evaluating our progress. We will establish a disability inclusion community of practice and, over time, create minimum standards of disability inclusion, including barrier-free environments, physical space, and communication for our project offices. Reviewing the progress on these commitments will be continuous and form part of the quarterly reporting exercise. We will identify a group of persons with disabilities as staff and volunteers who will form an advisory committee that will act as a watchdog to protect and enhance the provisions laid out in this position paper. VSO UK 8